Well, hello, hello, hello. It has been forever, or as
It's
my
been a
daughter
hot
would say, five ever, which is more than forever.
minute.
It's been quite a while since we've met, so we've got some catching up to do and, you know, have find out what's going on with you guys. It's been crazy. How long has it been? Like a few months since we met?
Couple months, yeah.
It
He was
seems
in
like it's
May.
been,
Yeah.
yeah, it seems like it's been a while. I'll give you guys a quick update with me. So, okay, so when we met last, had my little granddaughter been born yet?
No,
No.
you had sent us some pictures, but we
Okay,
hadn't
yeah, my
talked.
daughter's like doesn't want to show her face on social media, so otherwise I'd be bringing her on and showing her off, but I need to respect their decision to do.
Yeah.
But yeah, she is today 6 weeks old.
Wow.
Yeah. And she's doing amazing. So she was 6 pounds, 2 ounces, 19 inches when she was born. And she had her at her 1 month pediatrician appointment. She was like 7 pounds, 6 ounces, I think. She's a tiny little thing. Yeah.
Oh,
And, but she's making eye contact. She's smiling. She's starting to laugh a little bit at 6 weeks.
wow.
Yeah. Mike, wait, what? We're live. Yes, I know.
Hey,
Amazing,
Mike.
isn't it? Hey, Mike. But yeah, so it's awesome. So we've been obviously busy welcoming our new little one into the home. Um, did you guys knew that we had to put Max down?
No,
Yeah, well,
no.
my dog Max, who like would show up on all my videos. Yeah, so he was 17 and a half. We had to put him
Mm.
down beginning of March. He just came to the end and he was done. So yeah, so little Max, the last of our dogs, he was gone. We have not, Dave and I have not been without pets since we were married almost 36 years ago. So this is our first time without pets. So of course it's been sad, but he lived a long time. Yeah. And so, and I finished the Nutrition Network course for the
Yes.
coaching certification. Yes, I did my oral exam last week. So I'm just waiting to get the grades, assuming I passed. And so that's,
I believe
yeah.
you did.
Yeah, I'm sure.
Yeah, I'm sure I did. So that's what's been going on in my life. And of course, super busy with Healing Humanity, of course. And now that the documentary is out, being shown all over the place, it's really cool. So, and it's going to be in my area on the 15th of August.
Yay.
Oh,
Yeah.
wow.
Okay. So I know, Renee, it's been a rough year for you.
Yes, it has. We put our baby Thor down last week.
Yeah.
But he was only a 10.
Mm.
He got lymphoma, or the vet told us that we probably were going to get a month, and we got 2 months. We put it when
Okay.
we went to him, and he was still wagging his tail, and he was still wanting everybody to pet him. So we didn't wait long enough, or too long. Our goal was not
He
to
wasn't suffering
realize he was really sick.
Yeah.
But let me tell you what, when you give a dog steroids, they eat everything they can put in their mouths. I mean, I came in one day and he was eating one of my Healing Humanity t-shirts.
Oh my goodness.
I'm not kidding. He was eating everything. So, it was time. But
yeah,
other than that, all I'm doing is working, and that's it.
Still working for Verda?
Yep.
Yep.
My
Good.
1-year anniversary is coming up in a couple weeks.
Wow.
Oh my gosh, already.
Yep.
Congratulations. That's awesome. Okay, Carrie, what's new with you?
Well, overall, things have been pretty good. But oddly enough, actually, a couple nights ago, I guess I slept wrong or something. I don't know what happened, but like I had this terrible crick like yesterday and into today where like if I move suddenly to the side, it just like it goes.
Oh, hate that.
So,
Hate that.
but to make it worse, my air went out and it's been 96 degrees here. Now, thankfully, the HVAC guy was able to come today. And so he got me straightened out. So it's starting to cool off in here. But I mean, we're having like these high temperatures in the upper 90s. And wouldn't you know, they had to suck the gunk out of the little pipe,
The
that
vents.
I've got a switch that automatically shuts it off so that like the water won't build up, like it won't stay on and leak. So if
Yeah.
that happens, if the water builds up, it'll just shut it off. So it did what it was supposed to do. So they came and sucked the stuff out, and
Yeah. So you're starting to cool down a little bit.
so I'm finally, I don't glisten. I sweat, y'all.
Oh.
I've never glistened. And so I'm just like, I know I must look a sight. Plus, I didn't sleep worth anything because I was hot.
Oh, I bet. Yeah.
It is hard I can't sleep if I'm hot.
Yeah.
So it's just been kind of tough, but I'm like, nope, the show must go on. So I missed you guys and I wanted to see you. So.
Oh my gosh, I know it's been forever, and it's good to get together again. I know, this is our little thing. So if life happens and we can't make it, we can't make it. So we just get together as often as we can. And
my brother and I went and saw Billy Bob Thornton's band at the Ryman Auditorium. It was Billy Bob Thornton and the Boxmasters.
Okay.
And it was really good. And then we've got Bob Dylan coming up on Saturday.
Wow. You're always going to great concerts.
So, yeah. I don't spend too much on stuff, but I do spend on concerts. Yeah.
Excellent. Good. Well, I don't even know where we left off. If you guys have your book
on page 158.
Yep. So for anyone who's joining in, who's not familiar with what we do, we are going through this medical textbook, and it is quite meaty. It's called Ketogenic: The Science of Therapeutic Carbohydrate Restriction in Human Health. We've been slowly going through it. It's not a book club, so we don't read ahead. We read and discuss as we go. And we are still on chapter 3, the endocrine chapter. So we stopped on page, you said 158 or?
158, and it's the insulin connection.
Insulin connection. Okay, so we were on the section about PCOS. Okay, yeah. So we had talked about, high insulin, hyperandrogenism, and they were talking about the link between insulin and reproduction. So going into the insulin connection, Renee, you want to start?
Sure.
Okay.
High insulin concentrations are predominantly responsible for follicular arrest by disturbing the delicate balance of follicle.
That's a tough one.
Sometimes our mouths just don't want to work. Follicle stimulating hormone, FSH, to luteinizing hormone, LH, ratio that triggers the correct follicular development. During normal development, FSH encourages the growth of primordial follicles into primary follicles, and a surge of luteinizing hormone selects the dominant follicle, which leads to proper ovulation. In women with PCOS, the high insulin concentration promotes the transition of primordial follicles to primary follicles. They also increase testosterone concentration, making the receptors on the primary follicles overly sensitive to LH. The primary follicles respond too early in the menstrual cycle and stop growing when they are still small and not ready for ovulation. Consequently, no single dominant follicle is selected and no signal is given for involution, shriveling up. The many small follicles simply accumulate fluid, and it is these numerous small fluid-filled cysts that are visible on ultrasound and clinch the diagnosis of PCOS.
Okay, so this is interesting because I had PCOS, and I was 20 when I started having symptoms, and it just makes me wonder because it's like, I wonder how quickly you can develop it. Like, how bad does your diet have to be in order to actually make a difference? Because I know when I was living at home, up until I was done with high school, I was living at home and I was basically eating whatever my mom had in the house. And it was they were Depression era. So it was always very conservative as far as the, and it wasn't like we had good, like quality food. Cause again, I've talked about before, I grew up on Imperial Margin and Crisco and seed oils but very small portion sizes and not a lot of sweets. So I'm guessing that once I got to where I was choosing my own food, I was probably making some pretty bad decisions. And I remember when I started having symptoms, it was in January of my junior year in college. And I was away at school. I was up in Canada. That's where I met my husband, actually.
Oh, yeah.
Yeah. I was up in Canada and I discovered fries and gravy, which is a Canadian thing.
Oh, okay.
Yummy.
It was.
Yeah, no kidding.
Yeah. I swear, I think most of my meals, once I discovered fries and gravy, I think most of my meals on campus were a huge plate of French fries smothered with gravy.
What type of gravy was it?
It was
it
was not homemade gravy. It was probably,
is it a white sausage kind of gravy, like with gravy and biscuits?
Like a light brown kind of gravy. It wasn't like a super dark, but it was kind of like maybe what you'd use with biscuits and gravy. Which is a really good gravy. And I remember it was an incredible combination. And Mike says, sounds delicious. It was.
Hey.
Yes. And that's us, bunch of geeks. That's right. It was delicious. But I was eating that probably a good semester. And then I would have ice cream. They had a ice cream bar that you could go and you can get ice cream. And so I would have fries and gravy and ice cream pretty much my whole first semester of college. I gained like 25 pounds. And then it was January that I started having symptoms of PCOS. Like, could it be that quick?
Wow. I mean,
makes you wonder.
It does.
Yeah. Oh, look who's here. It's Carrie.
Ah!
Yes, but it'll kill you. Yes. I meant to put Mike. I was like,
yeah, but it'll kill
you. Yeah, exactly. So like when I'm reading this, I'm talking about the high insulin and everything. I'm going, I know that that's what it was doing, because later when I started getting physical exams and stuff when I got diagnosed, that I was learning a little bit about how it was affecting my FSH and my LH, and I got them measured and they were off. But I was thinking, man, could I have done that much damage in a semester?
That's really sad if it really can happen that fast.
But it can be encouraging if it can happen that fast.
It can reverse.
Yeah. That it can also be resolved relatively quickly too.
Yeah. That's what I'm wondering too. Yeah. Because I know that fatty liver can heal very quickly if you get your insulin down. So maybe PCOS can as well. If only I had known.
Yeah. And when you're young, you don't make the best decisions. So, I mean, it's perfectly reasonable to eat the fries and gravy,
Well, I had never been overweight at all. And so it didn't even dawn on me that I would actually be affecting my health.
Yeah.
But I do remember by the end of the first semester, I was like, my pants are getting tight. It's like, I'm having trouble buttoning my pants.
Right.
So,
what's up with this?
Yeah.
I had a similar thing happen when I joined the military. Let me tell you about the not good food that you get served in the military.
Oh, yeah. So what were they giving you?
I mean, it was just really carb heavy. They cook things that are easy to serve to thousands of people. So
yeah,
I mean, in basic training, I think I gained over like 25 pounds just in basic training. Now, mind you, I was really super, super skinny when I went in because I was coming out of bad behaviors. But still, I remember my parents showing up at my graduation from boot camp and they're like, "What happened to you?"
What happened? Right.
And we were running like 2 miles a day at the minimum and doing a ton of physical activity. So it wasn't like, we weren't working out, but
right. That's the food. Yeah.
Yep.
Hello.
Hey, Jeannie.
Yeah, I know everyone's probably going,
That's
holy
like
cow,
old home week.
they're back. Okay, so sorry. I just had to talk about this a little bit just because it's so like something I experienced.
Well, I think, I don't know. I was never diagnosed, but those recurring times every month were, I mean, I started out like just, it was terrible. Like my
Me
dad would
too.
have to come get me from school, like in junior high. I mean, if it happened that morning, I just didn't go to school. But I mean, ultimately what would happen is it would happen while I was at school.
Yeah.
So my dad, we
Yeah.
had one car at the time when I was growing up. And so my dad would come pick me up and take me home. I mean, that was just it, but it was awful. And
It was for
I
me
look
too.
back and wonder if maybe, but I mean, apparently I didn't have trouble, becoming pregnant, but
Yeah.
it was like, but at the same time it was awful every month.
Yeah. I don't know. I didn't realize it. And now I've learned this, but I did not, no one ever told me that and of course we're talking about periods. So it's like, we might as well just call a spade, right? Talking about periods.
Yeah, might as well. Sorry,
a normal length menstrual cycle for a woman is 5 days.
Mm-hmm.
That's normal. And it's not supposed to be very super heavy, and it's not supposed to be super painful. And I wish somebody had told me that, because mine was never less than 7 days. And it was also incredibly heavy, and it was incredibly painful.
Yep.
I mean, I remember there was a time where my lips went numb because I was in so much pain. It's like in my like chick stuff. That's right.
Stuff.
It affects men too, if you're married or if you've got sisters.
Yeah, if you're around somebody,
if you're around women, man, does it
Yep.
affect you? But I wish someone had told me what normal was supposed to look like, because I was never normal.
Mm-mm.
Yeah, it does. It's awful. So
I will say, though, that I hear that frequently from my female patients, that they're really surprised that their menstrual cycles become more tolerable and they become less. And I mean, it is absolutely, you tell them, they're there for mostly weight loss, but then they're like, all of a sudden, like, oh my gosh, I just had my first period that was, I could deal with it. And it was comfortable. It wasn't awful.
Mm-hmm.
That's what happened with my daughter when she went carnivore.
Yeah.
Because she had endometriosis. And it was not only super heavy and super painful, but like with people with endometriosis, they'll explain their legs feel like jelly. Like they can barely even stand on their legs. It's so awful. And she went carnivore, and the next period she had, this goes to the fact that it can reverse quickly.
Mm-hmm.
The very next period she had was like 3 days and no pain.
Wow.
And she was like,
that's phenomenal.
Yeah. Yeah. And then she got pregnant.
I could have saved so much misery if I had known in my youth. And I ended up, I had endometriosis and a prolapsed uterus because of my son, because he was so big. But I ended up having a hysterectomy after he was born. So, but
yeah,
it was, I could have.
I had a hysterectomy too, because I didn't have endometriosis, but I had inside of my uterus the same thing.
Yeah.
And I would have to take 3 days off from work just to lay in bed with pain meds because it was so awful. So, I mean, I really what would have happened if I'd done carnivore before the hysterectomy?
You probably wouldn't have had the hysterectomy.
Right.
No.
Yeah. Yeah. I mean, my daughter didn't even think she was ever going to be able to get pregnant. And she would be doing hair. Like she was a colorist at a really high-end salon, and she would be there doing hair with her and endometrial pain and just be dying.
Yeah.
And so it can reverse pretty quickly. It just is amazing to me how, and for me, I'm assuming for me, it was less of a sugar thing and more of a seed oils, because I didn't, even when I started having the real trouble as a teenager, when I was having the really, really heavy cycles, I wasn't eating a lot of sugar, and I wasn't eating a lot of food.
I wasn't either. And like growing up, we didn't have sweets in the house. We didn't even have sodas. So it's not like, we were just eating a bunch of, cookies and stuff like that. But there was bread. There was a lot of white bread,
Yes,
staples.
me too.
Like it'd be bologna sandwiches, or it'd be peanut butter and jelly.
Yeah.
Or
a lot of, and it was
like
a lot of carbs.
Mm-hmm.
Mm-hmm.
Yeah.
My house was full of sugar. I didn't even know you could drink water until I was an adult. We drank soda.
Wow.
And that was all we ever drank. I'm paying for it with my dental work right now.
Oh, I bet. Yeah. Wow.
Mm-hmm.
Yeah. So it's true. I mean, I was not much of a meat eater. Well, when my mom made meat, she cooked it to be like leather.
Oh gosh, my mother did too.
I hated meat. So
I mean, it was so well done, everything.
Yes.
It was, and I didn't know how delicious meat could be. And I may have told this story on my 21st birthday. We went out to eat, and it took us a while to get our steaks, and I had ordered mine well done. Well, they brought our steaks, and my ex-husband, he had ordered his medium rare. Well, they ended up bringing both steaks out as medium rare, and I was so hungry by that point.
Yeah.
And I'd had a couple of drinks, and I ate it, and it was the best steak I'd ever had. And so at that point, that was when I started actually having a steak or ordering meat where it wasn't just like cooked to death,
Yeah. Yeah. Mike says, we had crappy cuts of steak overcooked too. Please pass the ketchup. Yeah, I hated beef. I hated beef because the only beef I ever had was just like, I remember as a kid going, that was the meat where I had to chew and chew and chew and chew. It's like I can never
your jaws would get sore.
My jaws would get sore. So
and then it would just get bigger and bigger in your mouth, like it wouldn't ever break down. It was like
just terrible.
This big cud in there.
Yeah. So of course I wanted to eat carbs.
Yeah.
So, okay.
Memories, right?
Yes. Yes.
Okay. In women with PCOS, insulin sends its stop growing message to the follicles much too early. These immature follicles cannot be expelled as mature eggs, nor can they invulate. Eventually, they just become cysts. Lots and lots of cysts. Insulin causes this follicular arrest, which results in polycystic ovaries. During follicular arrest, no dominant follicle grows large enough to ovulate. The result is a menstrual cycle in which no ovulation occurs, an ovulatory cycle, no ovulation.
And ovulatory.
Thank you. An ovulatory cycle, no ovulation, no egg, no baby.
So, eventually though, the involation where they like disintegrate, it does eventually happen. It's just late. So I remember the doctor explaining to me, because I was like, well, so what happens to these cysts? And the doctor says that they do. So what they do is there's a bunch of them. None of them get big enough to actually like ovulate and to be a viable egg. But then eventually they do. It just takes longer, and then they get the fluid filled, and it takes longer. They get really painful, and it seemed like at a certain point, then they would shrink and go away. So it's maybe that part is delayed, because otherwise the ovaries would be full of cysts all the time, and it would just get to be more and more cysts every month, because this happens a lot of months. It's not every month, but a lot of months you end up with multiple follicles and that grow into multiple cysts. And if they didn't shrink back, it would just compound. And before you knew it, your ovaries would be bursting.
Not something I'd like to experience.
No, it was pretty painful. Yeah.
Almost all women will experience a few anovulatory cycles in their lifetimes, especially during puberty and menopause. However, the excessive insulin and testosterone and PCOS cause reoccurrent anovulatory cycles. Since testosterone is overproduced due to high insulin, the single most important cause of that word is just going to keep showing up, isn't it?
Anovulatory.
Anovulatory cycles is high insulin. Both weight loss and insulin-lowering drug metformin lower plasma testosterone and improve ovulatory rates. Indeed, all known treatments to reduce insulin, including weight loss, bariatric surgery, and the drugs samazostat and metformin, significantly improve ovulatory function and reduce the symptoms of PCOS. Interestingly, patients with type 1 diabetes who use high doses of injected insulin also have an increased risk of PCOS.
Go figure, huh?
Yeah, that would make sense.
Mm-hmm.
The bottom line then is that the three defining features of PCOS, hyperandrogenism causing sorry, I have to move my book where I can read it. Masculine features, polycystic ovaries, and anovulatory cycles all reflect the same pathophysiology. Too much testosterone, ultimately caused by too much insulin. It just sounds so simple.
It does. Yeah.
In other words, too much insulin causes PCOS. Like obesity, PCOS is best understood as a disease of hyperinsulinemia. Although obesity and PCOS do not always occur together, they are manifestations of an underlying hyperinsulinemia. The eponymous criterion
Sounds good to me.
that's a new word for me, of PCOS is the presence of multiple cysts in the ovaries, which are derived from the multitude of small follicles. Many women have a few cysts on their ovaries, but the sheer number of cysts distinguishes this syndrome from virtually all others. Almost no other much insulin.
That doesn't make sense.
Okay, so it's not just me.
It's not just you.
Almost no. Okay, so let's see where they're going with this. And too much testosterone. Okay, almost no.
Somebody was tired when they wrote that sentence.
Okay, so I'm then going to say that it's supposed to say too much insulin, too much testosterone causes polycystic ovaries.
That makes sense.
That sentence is okay.
So yeah, I read it like I read it like there's almost no other diseases where high insulin and high testosterone are present that causes polycystic ovarian syndrome, but that still doesn't make any sense. That's like the worst sentence of the book. I think that's the worst sentence of the book so far.
Oh my goodness.
Yeah, I think somebody was just really tired.
Somebody was really tired when they wrote that sentence.
And then you know how many people edit these?
Yeah.
I'm just saying. Okay. Ultimately, these polycystic ovaries are caused by too much.
Mm-hmm.
Okay, this is not Nadia Pataguana wrote this section. I want to get the question here, or the comment question maybe. So from Susan. Hi, Susan. So she says, my 16-year-old granddaughter has been recently diagnosed by ultrasound of having a golf ball size cyst on her ovary. She has regular periods, but with cramps, and lasts about 7 days. Standard American diet, keto healing. So there's a difference between polycystic ovaries and a cyst on your ovary. So it's definitely important to make sure if it's truly a cyst on her ovary, it may be something that she needs to have surgically removed, as opposed to polycystic ovaries, where the cyst is the follicle that it was supposed to become an egg. And like I said, it does dissolve back into the ovaries. So I definitely would differentiate between what exactly it is. Not that going into ketosis isn't going to help her, but it may or may not shrink that particular cyst.
My ovarians used to just burst and then they would just get reabsorbed. So they would be there in an ultrasound and then they'd be gone a couple months later.
Then they'd be gone. Yeah. The doctor would evaluate whether or not it needs to be removed or whether it's of concern. But yeah, I mean, and I don't know I hear a lot about iodine and iodine deficiency and the tendency to have cysts. So I don't know if that's a factor or not. But it'd be interesting to see if like an iodine loading test, if she's iodine deficient, because a lot of people like Dr. Bernstein's iodine book, he talked about, and then also what was the other book about iodine? or I think it was called Stop the Thyroid Madness, but it was actually about iodine, and it talked about also other cysts that iodine can help, and that iodine tends to shrink cysts. You got to be careful. You got to be careful with iodine, but yeah.
But going keto certainly couldn't hurt.
Yeah, I mean, if you're looking for metabolic health, I mean, when it comes to like tissue proliferation, which is basically what happens when you get a growth, is you get an overgrowth of tissue. If you want to help turn your health in the opposite direction from that, you do need to improve the metabolic health. So improving insulin resistance is going to improve that. In our cells, in our mitochondria, we have two arms of one that have to be in balance. One's called a metabolic arm and one's called a mitogenic arm. And if they get out of balance, the mitogenic arm is dominant, and that's the arm that tends to promote inflammation and tissue proliferation. So it promotes growth of tumors. So it's really important to correct that metabolic imbalance. And so I know that's kind of sciencey, but again, we're science geeks. So from the perspective of getting cysts and having excess growth of tissue, improving the metabolic health will help shift in the opposite direction. I hope that makes sense. So I don't know, does that make sense?
You explained that very well.
You did explain that very well.
Yeah, so my sis, Dr. Bright, is a big iodine advocate. I know she is. And I'm always, I don't know, Renee, when you guys, I know you work for Verta Health and everything, and so you're like in the industry. Is there like a tendency to want to be really like cautious when it comes to recommending iodine?
We don't recommend any supplements at all.
Okay.
Because it's outside of our scope of practice.
So you're really cautious. Yeah.
The only thing that we recommend is magnesium. Anybody who's going ketogenic, we put them on a magnesium supplement right away to help with the leg cramps and to help with that transition period. But that's the only thing that we recommend. I personally have been using iodine for over 2 years. I don't have I had a huge nodule on my thyroid that you could actually see, and it's gone. But I also fixed it. It took a lot to get my thyroid where it needs to be.
The thyroid is really tricky.
That's really encouraging, for others to hear that.
Oh yeah. I mean, I work with a naturopathic doctor, and so the naturopathic doctor is okay with me taking an iodine supplement. But I'm like super, super cautious. Like whenever I talk about iodine, my big thing is go investigate it, learn about it. I'm not going to tell you to take it or not to take it. I'm going to tell you to go and get educated about it. Talk to, like, a normal doctor is probably not going to know anything about iodine, but you could talk to a naturopathic doctor or a functional medicine doctor, probably get some good information. But I would definitely like do an iodine loading test and just see if there's a deficiency, and then maybe go see a naturopathic doctor and, get some advice on dosage. Hopefully they'll know. I don't know. I don't know how many of them know a lot about it, but yeah, worth looking into for sure. So.
All right. Yeah. Both the cysts on the ovaries and the hyperandrogenism. Thank you. My brain is not functioning with my mouth today. Are caused by the same underlying problem, too much insulin. There, I made it through the paragraph.
All right. You want me to read?
Sure. Maybe your mouth works better than mine.
I'm usually pretty good with pronunciation. Not always.
Ever since I became a nurse, that's always been my downfall is pronunciations.
Well, it's like they throw all these crazy words at you.
I think they make them up just to make them hard to say.
I swear. I remember when I was in nursing school, I used to go, who named all these drugs? Like, they
just throw a bunch of letters on the desk and just.
No, pharmacology was the worst. Thank goodness it wasn't oral.
Yeah, it was crazy. And it's funny because one of my house guests is on metoprolol, and I told her I can't tell you how many current nurses still can't say metoprolol. It's still mispronounced, and that's not even a difficult one.
No,
like Okay, so this next section is called hyperinsulinemia, insulin resistance, and polycystic ovarian syndrome. So all known forms of insulin resistance are associated with PCOS. By 1980, hyperinsulinemia and insulin resistance were noted in obese PCOS patients. Hyperinsulinemia is independent of the degree of obesity. The conclusion is that hyperinsulinemia drives PCOS. Moreover, the phenomenon known as insulin resistance causes hyperinsulinemia. So, so I feel like they need to define it. Maybe because they're talking to doctors in this book, they know that doctors know the difference. But hyperinsulinemia is too much free-floating insulin in your blood. Insulin resistance is where your cells become resistant to the effect of insulin. So that little receptor in the cell that allows insulin to attach and do its job starts to become malformed so the insulin can't dock there. So that's the difference. So they are, even though they're both related to insulin. Right. So what it's basically saying is that the insulin resistance, so the cells get resistant first to insulin and they stop allowing the insulin to dock and do its job. And so the pancreas is like, oh, I don't have enough insulin. I can't get the glucose into the cells. The insulins isn't signaling right. I need to pump out more insulin. And so the pancreas, the beta cells start pumping out more insulin. And that's when you get increased insulin in the bloodstream. So what they're saying is it starts first at the cellular level, and then you get excess insulin in the blood. So let's see. We went to Cirque du Soleil show in Vegas, and they did a thing where they picked an audience member and played a game where they say a word and the person had to say it. It was it was a medication. Oh no.
That's really sad, actually.
Yeah, that's funny. Yeah, pronouncing these things are crazy. Okay, yeah, so that's what that says. So because it sounds like what? All right. So insulin resistance is a factor in type 2 diabetes and a risk factor for metabolic syndrome. Although it's weird because of all the criteria for metabolic syndrome, they don't ever even test your insulin.
Yeah, they don't. And
no,
that's been one of the more perplexing things, because that's a key diagnostic. You know what I mean? Like that's like
the main
thing.
Right. Like it causes the metabolic syndrome, but it's not one of the diagnostic criteria, and they don't even test it.
Right. Like you had to ask your doctor, like I had asked, to get my fasting insulin
that
tested.
was the first time I saw it, was when I asked for it.
Yep.
And he's like, well, what are you going to do with it? I was like, and my doctor is a carnivore, and he is very out of the box thinking, but I taught him about HOMA-IR, and I'm like, I'm going to see what my risk is. Like, I'm going to see where my metabolic health is. And so, I mean, sometimes we have to teach too.
Yeah. Yeah, definitely. Yeah. Interesting. Okay. So, so it's an underlying issue for metabolic syndrome. Where did I leave off? Here we go. Okay, it is this association with hyperinsulinemia and insulin resistance that firmly established PCOS as a metabolic disorder and accounts for the increased prevalence of type 2 diabetes, central adiposity, and metabolic disease in women with PCOS. Metabolic syndrome affects an estimated 1/3 of adolescents and half of all adults with PCOS. Our next section is called the link between diet, insulin resistance, and polycystic ovarian syndrome. The overflow paradigm explains perfectly the selective insulin resistance seen in PCOS, type 2 diabetes, and obesity. If you eat a diet that is very high in sugar and refined carbohydrates, and if you eat frequently throughout the day, you are constantly stimulating insulin, leading to hyperinsulinemia. In other words, all the related metabolic diseases of obesity, type 2 diabetes, PCOS, and fatty liver disease are caused by the same underlying condition, too much insulin. In PCOS without type 2 diabetes, that was me, you most often find normal blood glucose, but high blood insulin concentration. Of course, no one ever checked that with me. This situation is often called insulin resistance. That is, insulin has succeeded in pushing glucose into the overflowing cell, but the situation has not been fixed because the moment insulin concentration reduces, glucose will rise. Hyperinsulinemia is a temporary band-aid. This is the key to understanding PCOS, and indeed all the metabolic diseases. The underlying problem is the same, too much insulin. The solution then becomes immediately obvious. We need to lower insulin. While women may have genetic or other factors that predispose them to PCOS, lifestyle and particularly their body mass index likely determine their position on the spectrum. Weight gain moves women towards the severe end of the spectrum. Weight loss, in contrast, moves women towards the less severe end of the spectrum by improving fertility, ovulatory cycles, and hirsutism. So I experienced this with my cousin. So I have a first cousin who also got diagnosed with PCOS. And I was the weight gainer and she was the lean one that never gained weight. And I read, I don't know if it's still the same, but I read it's only like 40% of women with PCOS actually have a problem with the weight gain. And that may have changed over the years. This was like in the 90s when I read this. And there's a ton more obesity now than there was back then. But she was able to get pregnant and I wasn't. So, and she never had the weight problem, but she still had PCOS. So she was the less severe and I was the more severe. All right. So managing the patient. So aims of care. The primary aim of care should be addressing the underlying cause of PCOS. So pharmacology, here's the drugs. Refer to the recommendations for from the International Evidence-Based Guidance for the Assessment and Management of Polycystic Ovarian Syndrome. Most PCOS treatments, with the exception of metformin, do not treat the underlying pathology of hyperinsulinemia and PCOS and should be adjunct treatments. By focusing efforts on serum insulin reduction, not only do we address the symptomatic relief of PCOS as well as infertility, we also reduce the risk of the metabolic consequences of insulin resistance in patients with this condition. It is incomprehensible that this is not the focus of current medical therapies for PCOS and begs further consideration, as many of the current treatments are insufficient. So, one is symptomatic treatments and two are fertility treatments. So did you want to pick up, Carrie, and read?
Yeah. Symptomatic treatments. The methods in this category are prescribed to treat symptoms of PCOS. The birth control pill. The birth control pill, BCP, is a hormonal contraceptive containing estrogen and progesterone hormones in a variety of formulations to improve menstrual irregularities, reduce androgen concentration, and increase liver production of SHBG. I forgot what that stands for.
Sex hormone binding globulin, I think.
Thank you. Yep. Which reduces symptoms such as acne and hair loss. There are also side effects to consider, including the higher risk of blood clots.
Spironolactone.
Spironolactone is a diuretic drug introduced in the late 1960s that blocks the actions of androgens at the level of the receptor. It does not reduce androgen concentration, but it alleviates symptoms such as excessive hair growth and acne. Hair may be reduced by up to 40% with this drug. Important side effects include
hyperkalemia. That's too much potassium.
Okay. So they have too much potassium, right? Okay.
Which can be dangerous.
Very much so.
And probable teratogenicity.
Isn't that like toxicity to a fetus?
I do not know.
I think so, because it goes on to talk about birth control to prevent pregnancy.
And thus must always be used with birth control to prevent pregnancy and the possibility of birth defects.
Yeah, so there you go. Toxicity to the fetus. Yeah.
Metformin. The American Association of Clinical Endocrinologists suggests that metformin be considered as an initial therapy for women with PCOS, particularly obese women. It improves insulin sensitivity and reduces the hyperinsulinemia behind type 2 diabetes and PCOS. Lower insulin concentration reduces ovarian production of androgens, the hallmark of PCOS. Metformin takes at least 3 months prior to conception. Wait a minute. Metformin taken at least 3 months prior to conception increases pregnancy rates, reduces miscarriage, lowers rates of other pregnancy complications, including gestational diabetes and preeclampsia. Like any other drug, metformin has the potential for side effects, mild to severe gastrointestinal discomfort, but these are negligible compared to the benefits for PCOS.
Yeah. And Mike says,
Yeah.
I'd like to sell a consonant. I'd like to sell a K. Potassium. Yeah, I did. So no one offered me spironolactone, but I did. The first thing they did was put me on birth control pills. And then they did try metformin with me. I don't remember for how long, but it seemed like I was having side effects and it kind of wasn't really working. So I quit taking it.
Yeah.
Yeah. It might have been the side effects that were actually the most bothersome for me.
And I think they put, looking back, and of course, this was like the 80s, and they did put a lot of like teenage girls on birth control for like because of like heavy periods and stuff. And they weren't really tested for anything else. It was just like, oh, well, these birth control pills will reduce your flow and your discomfort. I never went on them at that point. I mean, I did later, but not.
Yeah, a lot of girls did. And it was not like a, well, why don't we figure out why
I started birth control pills when I was 14 because of my periods, and I took them until I was 28. So 14 years of pills.
Wow. Crazy.
Yeah, I took them after I had my daughter. I took them until I got off of them. Funnily enough, I got off of them because, they said, I believe it was like, you don't want to be on them for like more than 10 years. Or, you want to either change or do something else, but you don't want to, or that was the way it was explained to me at that time. So I got off of them, and 2 months later, I got pregnant with Hunter.
Oh, wow.
So he was that quick. It was like,
that was quick.
Yeah. But anyway, I think that they, in terms of like young teenagers, especially in the 80s. Yeah. Cause like I had a dear friend who was, for example, and I just remember kind of being shocked because to me, in my little brain, I just like looked at, oh, somebody being on birth control, that means people are just saying it's okay for you to just, go out and do stuff. You know what I mean? Like I kind of looked at it like that and not, I don't know. It just seemed kind of questionable to me, I guess.
Yeah.
That they would just put these young girls on it. And it's like, oh, okay, hey.
Yeah. Well, I mean, doctors they go to medical school to learn how to prescribe drugs in a lot of respects,
And like you said, they didn't really test, and maybe they didn't know to test, or I don't know, but it was like there was nothing that I could tell. I mean, my friend and I, for example, we talked about a lot of stuff, and she just said, oh, they put me on birth control pills. I'm like, oh, okay.
I don't want to be like a super ultra feminist, but I kind of am anyways, when it comes to women's health. It's like there was a delay in making women's health priority,
Absolutely.
and it's sad. It just did not get the attention and it may be because it was later that more women became doctors or researchers and scientists. I don't know what it was, but it's just like, even in the 80s, it seemed like things that were related to women's health really weren't taken nearly as seriously as men's health.
I have a theory about that, actually.
Okay.
I think that generations that came before us never talked about it. And I'm very upset with my mother for never telling me what menopause was going to be like. But that was something that they didn't talk about, and her parents didn't talk about it, and
That's
their
true.
grandparents didn't talk about it. And so if we're not talking about it amongst our families, are we talking about it to our healthcare providers?
Probably
And
not.
Healthcare providers even
Right.
knew that there were these issues going on, because women, I mean, come on, look at some of the ways that we were treated in the history of medicine and how they did, like just the hysteria part of PMS and how it was treated back in the 1800s. So I think
Oh, yeah.
I think
Well,
that
that's where hysterectomy comes from, right? Hysteria.
that we just got to a point where it was easier to not talk about it because we were crazy if we did talk about it. And so our
True.
parents and grandparents were raised not talking about it.
Yeah,
And
that's
I
true.
believe that without social media, I believe we probably wouldn't be making the bounds that we are, because I think that gets people a platform to actually talk about it. As much as I don't like social media, I think that it's a platform for people to actually learn about things.
Yeah. Yeah.
So that's my
true.
theory about why women's health has been
That's a good theory. That's a good theory.
No, I
And
think that
another
that's
thing,
accurate. I do think that's true.
Yeah,
Thomas
and
doesn't
like
remember
even
having
with-
PMS.
we used
I
to
swear
call
men have
putting
PMS.
up with men's stuff.
Putting up with men's stuff is PMS. That's funny.
Yeah.
Oh,
used to
I
joke
swear
about
men
that.
have cycles. They have some cycle. I think they have maybe
Yes, they
3-month cycles or something.
Yeah, they do. And I don't know enough about it I just remember hearing that they have some kind of a cycle too. But
Yeah, I've read about it and about the hormone fluctuations through the month. And I mean,
Mhm.
it's not like us, they're not going to ovulate
Yeah.
and have a period, but they
Right.
still have periods where their hormones change too.
mhm.
Yeah.
And I think it
Yeah.
goes right with mine. My husband is synced up with me. Hey,
Oh, yeah. Post mental status. Oh my goodness. So
All right. And then the next option, surgery. Oh joy.
I remember hearing
Yeah.
about this and considering this. I'm glad I didn't do it.
Yep. Surgery, like the ovarian wedge resection performed by doctors Stein and Leventhal in 1935, was successful but is rarely used today due to high complication risk. Wonder what that is. Doctors may use the less invasive laparoscopic ovarian drilling method to reduce ovary testosterone production as a last resort. LOD is not always successful with contraception rates similar to the medical oral therapy treatments listed above. Surgical complications include excessive scar tissue and decrease in ovarian reserve and function. So, Lynn, do you know what that method by Dr. Stein and Leventhal, the ovarian wedge resection?
Yeah.
Do you know
Like
what
they
that is?
literally cut a wedge out of your ovary. Kind of like if you're slicing a cantaloupe or something, and you slice a wedge out of it, or a watermelon.
Holy
They take a
moly.
wedge out of the ovary. Yeah.
Okay. Well, now I know. So what was that supposed to do? I mean,
I don't remember.
Yeah, I was just curious because it's just, I mean, like just taking a hunk out, like I was just wondering is it a hunk that has the cysts in it, or is it a hunk that
No.
has some kind of a duct in it that produces hormone maybe, or I was just
Yeah.
kind of curious.
I don't remember. Honestly, I don't remember what the rationale was for it.
Yeah, it sounds
I
terrible.
think bleeding would be a huge complication from it, though, because how do you sew up and stop bleeding in a wedge you've taken out of it? I mean, could you imagine and back then, we're
But how
1935.
vascular is the ovary?
Yeah, I don't know.
Yeah,
I mean, people can have an ovarian cyst rupture and bleed out.
True.
mhm.
So, I mean, and look at ectopic pregnancies. I mean,
Yeah.
there's I think there's lots of blood flow down there, but I'm glad you didn't have anything done, Lynn.
I'm glad I didn't either, but I remember considering it. Let's see. I'm going to ask, what does ovarian wedge surgery do? I don't know if that's a good way of asking it. okay, it's supposed to, they say that it is supposed to lower male hormone levels and restore ovulation. It cuts down tissue that makes excess testosterone, helps the body release eggs regularly, and brings back monthly menstrual cycles. But the scar tissue often cause painful pelvic adhesions. There's a risk of early ovarian failure from removing too much tissue, which is what they mentioned here. So I wonder if there's a specific part of the ovary that makes testosterone.
Mm-hmm.
And then how would they know? Like that, it's just amazing that in 1935 they were already looking at that and figuring out what part was causing the problems.
Yeah, that is.
Or maybe it was a crapshoot and they didn't know. They just sort of guessed at which part. Maybe. I often wonder that myself. Like, how do they actually know that each of these things does that, whatever it is? Like, how, because you don't really see it do it. So it's like, how do you know that this produces this and then this does that? And I mean, obviously they know somehow, but I don't know. I think about weird stuff like that. I just have these questions.
So it says testosterone is primarily produced by the theca cells within the ovarian follicles.
Huh.
These cells form the outer layer of a developing follicle. Okay, that's not helpful. Oh, let's see. So there's hilus cells located in the hilum, the base where the blood vessels enter the ovary. These cells are structurally, so it looks like there is a specific location of the ovary where they're located.
Okay.
So there's also interstitial cells. There's scattered hormone secreting cells located in the connective tissue of the ovary. So it's probably this hilus area, because the other areas look like they're everywhere. But the hilus cells look like they're structurally in a specific place. So maybe that's what they were located, cutting out was that area. Just guessing.
Then you wonder how they found that in 1935. I mean, how many women did they have to cut on to?
Oh, yeah. Sounds barbaric. Yes, I agree.
I agree with that completely. Whew.
Yeah.
And eating a ribeye is just so much more pleasurable.
Yes. And speaking of which, dinner is ready. So maybe we can stop here.
Okay. Yeah, this is a good, because we'll be at
fertility treatments. Yes, which I'm already recognizing. I did quite a few of these. So. Well, it was good to get together again. It's like,
and so many of our friends joined us.
Yeah,
too.
I know. Isn't that awesome? It's like we could be gone this long and still have people come back and say hi, which I love.
Yeah, me too. I hate it when life gets in the way of stuff, but it just happens. But I'm still alive and kicking. I'm still carnivoring.
Right. Awesome. And Renee, are you doing anything with your channel lately?
No. I posted some pictures on my Instagram finally, but no.
Oh, okay.
Life
has been hard.
It has been. And when I'm off of work, I just want to vegetate. And, just so we're not cryptic, I've lost quite a few family members this year, and our dog and my son had some pretty significant things happen in his life. So it's like when I finally get off of work, I just don't have much left. And I'm working on getting it better, and I'm focused on that. And the one thing that never waived was my carnivore. I don't know what I would have been like without having all this anxiety and depression gone. Like, I don't know how I would have made it through this year. So I'm so grateful for this, and I'm so grateful to be able to.
Are you going to be able to get to one of the showings of the documentary?
Unfortunately, the one in Phoenix is on a weekday. It's like a Wednesday, and I have to take 2 days off from work to get up there to go. Because it's a 3-hour drive.
Is it not in Tucson too?
No,
or is it just in Phoenix?
It's at the same theater, I think, that we did the meetup.
Yeah. Okay.
So it's a heck of a trek for me to try to make it. So no, we're not going to. We've got.
Well, there is a clip of you in it.
I heard, and I can't wait to see it. I'm just have to wait for it to hit streaming.
It'll end up with streaming. Yeah.
So I can't imagine somebody's not going to pick it up. Like, honestly.
And Carrie, what about you? We're going to be showing it at Low Carb for Better Health in September. Are you planning on coming to that?
I think so. I have not, honestly, until you just mentioned it, it had just totally like, the low carb, better health just totally like flew out the window. So I'll do some checking to see if we can get a room. Maybe my daughter will go with me or my brother.
Yeah, Dave and I are going to be there.
Carnivore brother.
Yep. Yeah.
Yep.
Yeah, we'll be there. So and they're going to show.
They're going to be showing it there, right?
Yes.
No.
Yes. Yeah. So awesome. Very good. Well, it's good to see everybody again, and glad we were able to get back into the book. And we will say goodbye for now.
See you guys.
Bye,
Have a wonderful
everybody.
day,
It was great
everybody.
to see you.
Yeah.